So if you're only missing one tooth, why a dental implant over a traditional bridge?
Yeah, that's a great question, because traditional bridge is something that I learned how to do in dental school, and that's where we carve down a tooth on either side. So already, if it's a healthy tooth that doesn't need a crown, we're putting crowns on teeth. So we have to shave them down, and as a result of that, about 40% of teeth that get carved down end up needing a root canal.
Okay.
So and a bridge only lasts maybe 10 to 12 years before it might need to be replaced, and it having a cover on it like that makes it a little bit more open to having decay. So we could get decay there. So it's not the best option, and not putting anything there isn't a good option either, because we start to have the spaces closed, teeth shift, and it's oftentimes how it leads to more tooth loss. So both ways can lead to more tooth loss. So if we put an implant in there, and the implant protects the teeth on either side of it, and it allows us to put just a single crown right on the implant, and it's a perfect way to preserve.
And that could last for as long as your teeth last.
Yeah, it could. In fact, it seems that implants are lasting maybe even longer than natural teeth.
What about cost? I mean, in the long run, implant a lot less expensive?
Well, not only in the long run. If we look at the cost of doing a fixed bridge, and we have to put maybe buildups on the teeth and then put crowns, it can be pretty close. If it's off, it's about the same. Yeah, and but if we do a bridge, we could be looking at a lifetime of more work and maybe even more tooth loss. I do a lot of implants on people where I'm replacing not just the tooth that was missing from years ago, but also replacing the teeth that were used to make a bridge years ago. So now we're putting in, say, 3 implants instead of what could have been 1 implant.
Okay, so if it's your own family member and they're only missing 1 tooth and they're of age, you would do it?
Absolutely. If it was my family, if it was even you or me, I would say an implant is, if it's possible, is the best way.